Hi everyone, and welcome to this video on instrumental musicians' injuries demystified. And this is really just an introduction to start looking at what are some of the things that go wrong with musicians' bodies and what can we do to help offset that. This is not simply about treating things when they go wrong, but also about prevention. Let's not have these things happen in the first place, and it's kind of a much happier situation all around. So a lot of musicians' injuries, typically they're not things that happen in a moment, like you suddenly go, oh, I just pulled my shoulder or something. They're normally things that gradually build up over time, right? The sort of slow burn where something suddenly starts to produce symptoms, but actually the story began long ago. So we're going to look at some of the things that lead, the little breadcrumbs that lead us to the point when then the symptoms express themselves, so that we can see if we can get ahead of some of that. So this is very broad. It's just an introductory session, and it'll hopefully help you to focus your line of inquiry. By listening to this, you might think, oh, I really need to know more about how my nerves work and why I'm getting tingling in my hand. And then you can dive into one of my other videos where I'll go into more detail on those particular topics. But let's start. I'm just going to bring up some visuals here. And we're going to start by looking at what are the various body parts that can go wrong. People will often be horrified at the thought of getting tendonitis, for instance. And then I'll say, well, do you know what a tendon is? And they're like, no, not really. It's like, well, why are you scared of something you don't even know what it is? So hopefully this will help to, again, dispel some of the myths and help you to be able to isolate and kind of narrow down what it is that might be going wrong based on the symptoms that you're experiencing. So we're going to start with the bones, right? The skeletal system, because that's the sort of architecture underneath all the soft tissue stuff. If you think of the bones as being, the sort of sticks on the puppet, and then the muscles and tendons are the things that move the puppet around in space. And typically bone injuries in musicians are rare. I mean, in terms of injuries to your bones that are caused by playing your instrument are pretty rare, but you might damage your bone, you might get a broken bone, a fracture or something in another aspect of your life, which is then going to affect you playing your instrument. And obviously the wrist and hand come to mind. The most fractured bone in the body, would you believe, is the little bone at the base of your thumb there, and you can actually see it in the zoomed in bubble on that bottom right picture there where it says scaphoid fracture. The scaphoid bone is the one that sits just under your thumb, and when you fall over, typically the first thing you do is put your hand out, right? And the first bone to hit the ground is often that bone, which makes it the most commonly fractured bone in the body. And it does have complications, which can cause problems. If you want to know more about that, go and look at the video that goes into more detail on wrist injuries. But if you fractured that bone, in your outdoor pursuits or something, then clearly it could be affecting you playing your instrument. But on the left here, we see a picture of a bone spur. You're looking at the front of someone's right shoulder in that picture. And you'll see there's a little bone on the top, which you can feel on the top of your shoulder there. Underneath that, there's a tendon that runs to your arm, and it's the tendon that lifts your arm up out to the side. And if we get a lot of rubbing in there, I always say tunnels are trouble in the body, and this is a little tunnel when you've got tendons running through there. And if you're somebody who has an instrument where you're lifting that elbow up a lot, so bowing arm on string instruments, guitars, flute, can often cause a bit of entrapment of that tendon in that tunnel. If anything rubs in the body, it thickens itself. So if you lean on your elbow all the time, you're going to end up with a patch of rough skin, right? The body toughens itself up under load. Well, a similar thing can happen to the bone. So if that tendon is kind of chafing on that bone in the tunnel, you can get what are called bone spurs forming, which are like little protrusions that stick out from the bone. And then they're going to dig into the tendon and make the tendon even more angry. Anything that's angry in the body swells up. If you've got swelling within a tunnel, then you've got more friction going on, and it becomes this kind of slippery slope. So typically that condition in the shoulder, I've seen it predominantly in my experience in cellists in their bowing arm. That often requires surgery because you actually have to have that bone spur sort of lasered away so that you don't have the problem anymore, and we open up that tunnel. But when we're talking about healing rates from, say, a fracture or something, a broken bone, you're really looking at sort of 6 to 12 weeks. You might be immobilized during that time as well. But the remodeling of bone injuries takes up to 5 years. So they take a long time to heal. You won't necessarily still be noticing them 5 years out, but it's just interesting to note the healing process is still taking place. And one thing I just want to throw in about healing at this point is that always remember you're doing the healing, right? You don't come to someone like me or a physical therapist or something and say, you heal me. No, you do the healing. We help create the conditions in which it is easiest for you to heal. But again, the more you kind of take responsibility and learn and understand how these parts of the body work, then your healing will be that much kind of quicker and more easy to get through. So ligaments, what are ligaments? Ligaments are the sort of soft tissue straps that connect bones to bones at joints. We've got all these bones in the body where they meet at joints. There are soft tissue straps that keep them in place. Those ligaments are not elastic like a muscle is. They're not stretchy. They allow for some movement. They're pliant, right? So we get some movement at our joints, but they're going to restrict us moving too far. So again, ligament injuries are not typically something you're going to cause by playing your instrument. However, if you get a ligament injury again from a fall, a twist or something outside playing your instrument, it could affect your ability to play your instrument. So on the left there, we're looking at the elbow joint. There's actually two main bones that meet and a third one because we've got two bones in our forearm that come up and meet the one bone in our upper arm at the elbow joint. And there's a lot of ligaments around there that are strapping the joint together. The bottom right there, you're looking at the ankle, and that's the most typical place that people damage their ligaments. You might not think that would affect you playing your instrument, but if you stand to play your instrument, it well could. And when we injure ligaments, we typically talk about a sprain with a P. So you sprain ligaments. We can tear them, we can have sort of micro tears in them, we can have partial tears in them. If the whole thing is torn, that's called a rupture. So these are just sort of terms you might hear around ligaments. And I've also put in there avulsion. And basically what that means is if you damage a ligament quite forcefully, sometimes rather than the ligament tearing, it actually pulls a bit of bone away because obviously the ligaments are attaching to the bones. And if there's a forceful tear, sometimes it can pull a bit of bone away. And again, that would then require a more orthopedic approach to fix. Ligaments are slow to heal. So if you've had a ligament injury, a wrist sprain or something like that, they don't have such a rich blood supply as muscles and tendons, so they typically tend to take a little longer to heal. So anything from 6 weeks for a sort of, regular sprain to several months, depending on whether you've completely torn the ligaments or whether it's just a milder injury. But we always have to look at the cause. Why did that ligament get injured in the first place? And again, most typically with instrumentalists, that's outside of playing your instrument. Okay, so now we're getting into muscles. This is where we do start to cause ourselves trouble while playing the instrument. So muscles are contractile tissues, right? They are there to move the bones around in space. So they're made up of microscopic strands of fibers, like kind of microscopic hairs that are sort of bundled together in groups, and then each of those groups is bundled with another group and another group until we get a whole muscle belly, as we call it. And they shorten and contract and pull on their bony attachments, and that's how they're going to move one bone closer to another. And then obviously they can stretch and lengthen, so they can go from a shortened to a lengthened position with that elastic kind of motion. Now, when we talk about muscle injuries, again, there are lots of different terms that are used for muscle injuries. We talk about muscle strains. This is with a T as opposed to sprains with a P that belong to ligaments. You can't sprain a muscle. So strains, tears, you know, pulling a muscle, all of those things pretty much mean the same thing. Whenever you get muscle damage, you've got some degree of tearing, but we might be talking about just the little tiny microscopic muscle fibers versus a rupture where you might actually completely tear the whole thing in half. Again, you're not going to do that playing your instrument. That might be, you know, a fall or something more dramatic, playing a sport or something. But what we typically see with instrumentalists is what we call micro tears, little bits of damage. Now, anytime you tear muscle fibers, they've got a very rich blood supply. They're pink, as you can see. So when they tear, they bleed, and it's just kind of like your skin. When you cut your skin and you bleed, what's going to happen? The brain kind of goes, oh, we've got a leak of precious fluids. That's not a good thing. We need to plug it. And so on a skin, you'll form a scab, right? Which is a thickened, hardened bit. It's not, doesn't really behave like the skin around it, right? It's brittle. The same thing happens in muscle. We get what's called an adhesion. It's because it's made of sticky stuff, and it's there to kind of glue together the broken bits of muscle fiber. And it's like a quick patch, if you like. And that's often what people say when they can feel knots in their muscle. I always say you can't knot a muscle, that's physically impossible. But what you're feeling is these little kind of sticky patches where there's been some muscle tissue damage, there's been some bleeding, and you've got essentially what's a sort of internal scab at that point. And just by using a muscle in its normal orientation, stretching and contracting it, sometimes it can just kind of pull out those little sticky patches and allow the muscle to heal fully. But if you've had a more significant tear to the muscle, or it's damage that's been reoccurring over time, then often you need to go and get some soft tissue work, some massage work. What massage therapists and physical therapists are typically doing is actually combing through the muscles and finding these little patches in there, and then realigning the fibers back into their kind of longitudinal, as we call it, orientation, so you get full functionality back. Because just like the scab on the skin, if you overstretch the skin when it's got a scab on it, it tends to break and re-bleed. It doesn't stretch very well. So we don't want these little patches of unattended muscle damage left lurking in muscles, because they begin to reduce the overall elasticity, the stretch capability, and also the power of that muscle, and can increase your risk of further damage. So this is where we tend to see sort of the slippery slopes kicking in. So typically muscles are damaged by either overstretch, where you forcefully overstretch a muscle, again, not likely on your instrument, but might happen off your instrument. What tends to happen on the instrument is overstrain, so overuse, repetitive loading of a muscle. If you've got tears in the muscle, healing rates, again, anything from sort of 3 weeks to several months, depending on the severity of the injury. And again, it doesn't mean that it's like, oh my gosh, you've torn a bit of muscle fiber, you've got to take 3 weeks off. No, it just means that the tissue is not back to full capacity until that sort of 3-week minimum mark. So you need to be mindful that you want to be modifying how long or how forcefully you are practicing, for instance, in that healing phase, so that you're again giving the body the best opportunity to get the healing done. Because unresolved old injuries are one of the biggest risks for further injury. And it's something I see all the time with musicians. It's like, oh yeah, I've got this thing, it's been grumbling on for years, right? That you don't want these long-term issues. Okay, so we looked at muscles there. Now, muscles don't attach directly to bones. We have tendons that do that for us. So we talked about a muscle fiber being elastic and stretchy. It can contract and stretch. If you attach say a rubber band to a heavy plank of wood and try and lift it up, it's not very efficient, right? That you're going to get a lot of stretch out of the rubber band, and you're not going to get much purchase on that heavier piece of wood. And that's the same thing with muscles trying to move bones. So what we need is like a little bit of rope essentially at the end of our muscle that can transfer the load of the contracting muscle to the bone. And that's what tendons do. So they're very similar in that they're made up of strands and strands of microscopic fibers bundled together, but tendon fibers are not elastic, okay? They don't stretch like a muscle does, because that's their job, right? They're there to be that rope rather than the rubber band. So therefore, they're taking a lot of the force of the muscle contraction above it. Now, the injuries to tendons, again, very, very similar to muscle injuries. You can strain them, you can tear them, or you can fully rupture them. Again, that's a more traumatic injury that would be off your instrument versus on the instrument. But what we typically see is tendonitis, which we're going to look at in a bit more detail later on. Itis just means inflammation, right? Appendicitis, bronchitis, tonsillitis. It's just inflammation of the thing before it. So tendonitis, just inflammation of the tendon. It doesn't tell you why it's inflamed. It just tells you that it is inflamed. So tendonitis can be an experience, but what we typically see more with musicians is something called tendinosis. And this is more your chronic wear and tear of a tendon. The inflammation of tendonitis is typically only present 24 to 48 hours after initial injury. So that's when you get that flare up and everything's kind of angry and sore. The more grumbling chronic pain of a tendon that's been going on for a week or 2 weeks or longer, the correct term for that is tendinosis. We see that at the elbow quite typically in musicians. That's that middle picture there, and I'm going to talk about that in more detail a bit later on. But we can also have something called tenosynovitis, which is a bit of a fancy name. I'm kind of throwing these out there because if you go to someone for treatment and they say, oh, you've got tenosynovitis, and you just go, I have no idea what they're talking about. Now, perhaps you might be able to understand a bit about what that means. So some tendons in the body, not all of them, but some of them actually run through a sort of sheath, like a sleeve. And there's one particularly that comes down towards your thumb in the forearm here that runs through a sleeve. So the sleeve is made of synovial tissue. And so tenosynovitis is inflammation of that sheath, the synovial membrane around the tendon. The symptoms to you feel pretty much the same, but it's often an issue of that the tendon is not gliding in its sleeve very well. It's getting stuck and snagging and creating friction. And we're back to that idea of a tunnel causing trouble. So again, the way we approach that is similar in terms of treatment and rehabilitation, but in case you hear that term and you're not quite sure what it means, now you do. Okay, so the last little structures we're going to look at are the nerves, because we typically can see nerve issues in musicians. So just to give us a little bit of the sort of architecture of the nervous system to contextualize this for you. The nervous system is like the body's internet, right? It's the sort of signaling mechanism. We have what's called the central nervous system, which is the brain and the spinal cord, which is kind of like a long ponytail that extends from your brain all the way down your spine. And at each level of the spine, there's a branch of the nervous system that goes off to the right and the left. And each of those branches, they're called nerve roots at that point, they branch and branch and branch and branch, and it's a bit like a sort of tree that branches repeatedly. They go off and they serve many, many parts of the body, and that's called the peripheral nervous system because it's going out to the periphery of the body. Now we can divide, in a very simplistic way, we can divide our nerves into two categories. We have a sensory system, right? This is how we read our environment. So sight, hearing, smell, touch, taste are all our senses. So as musicians, you know, your sense of touch onto your strings or onto the keys of your instrument, your sense of hearing have to be very acute, right? So we have nerve receptors in those organs that run signals up that peripheral nervous system we just looked at to the spinal cord to send that information to the brain. The brain can then send signals in response to what that information that was coming in can send signals back down the nervous system to our muscles to respond to those stimuli. So that's called the motor system, the movement system. So essentially, nerves have these two jobs. They have some fibers that send sensory information, and they have some fibers that send motor information. And this is important because it tells us about the sort of symptoms we might be getting when we have issues with our nerves. So what can go wrong with them? So typically what we see with musicians is nerve entrapment, or nerves getting compressed. We're back to tunnels and funnels in the body. And that picture on the left of the screen, as you look at it there, is the front of a right shoulder again. And you can see those yellow things, the nerves that are coming out of your neck in this instance. They kind of bundle together and go through this very sort of small funneled area between bones and muscles in the front of the shoulder here, between your collarbone and your ribs, and then at one of your chest muscles, to go down to your arm. And they're the ones that are going to serve your fingers on the end, both for sensation and for power, for movement of the fingers. So if we're getting some squishing and entrapment of those nerves up in that shoulder and neck area, then we could be seeing symptoms right down into the hand. Now, all the nerves are bundled together around your shoulder. As they go down your arm, they actually branch out and become individual nerves, and they serve specific areas. And we'll be talking about a couple of those later on. But the sort of symptoms you're going to get if your nerves are getting squished somewhere along their route is typically tingling, pins and needles, numbness, or what we call altered sensation. It's like, I just don't get the same feedback that I get from my middle finger on my right hand versus my middle finger on my left hand. There's a dulling of sensation, something like that. In extreme cases, if the compression has been going on a long time, you can start to even get weakness in some of the muscles that nerve serves. So remember, nerves give us sensation as well as power. Pain can also be a feature from an irritated muscle. And again, it's typically a kind of burning electrical pain versus a sort of soreness of a muscle pain. So it kind of has a slightly different character. But we'll talk about those in a little more detail later on. But why are we generally, as musicians, prone to injuries? Well, repetitive motion, okay? So playing an instrument tends to sort of overuse certain areas of the body in a way that is not really natural, so to speak. You know, normally when we're walking and moving around, we're kind of sharing load across the body, that we're doing sort of what are called fine motor tasks, you know, finger movement, things like that. And working muscles very, very repeatedly. And we're often doing this for hours on end, for particularly those who like to over practice, and years of training. So we can get into overload and overuse issues. Typically for a lot of musicians, that training starts early in childhood. And so any habits you build, you know, as your nervous system is developing through childhood, as your whole musculoskeletal framework is developing, any habits you have around your instrument during childhood can kind of get really embedded in both the structures of the body, but also in the programming of our nervous system. And so shapes and postures can become quite habitual. And obviously we're interfacing with our instruments. These are sort of inanimate objects, much as most people view their instrument as an animate object, which is a beautiful thing, but they're not very compliant, right? So any accommodations around the instrument tend to be made by our bodies because the instrument's not going to change its shape. So we want to be looking at minimizing that. And then there's kind of the psychological stuff, you know, how many musicians are like, la, 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 not happening. I don't have pain in my elbow. No, no, no. And by the time they come to me with an issue, I'll say, well, how long's this been going on? Well, probably about 6 months ago, I first noticed it. You want to jump on it early. It's a false economy to just think, oh, if I ignore it, it'll go away. And bear in mind that pain can fluctuate. It can be there one day, not the next, and it can go away for a period of time. Pain is that's a whole other lecture on the kind of vagaries of pain. It's not as simple as something's in trouble, you'll get a pain signal. It changes with mood, it changes with length of time you've been exposed to tissue damage. So it's not a very good indicator of whether you're in good shape or not. So it can go away, but it doesn't mean the injury has gone away. And people say, oh, well, the pain went away before, but like now this time it's not going away, right? So don't ignore the early signs. And then stress and anxiety actually increase your injury risk, strangely. And I do a whole talk on the emotional practice environment and how your thoughts can actually directly affect muscle tension, muscle inflammation that can predispose injuries. So we can't just look at this from purely a sort of mechanical perspective. We also need to look at emotional states as well. So let's look at some of the causes in more detail. So the center of gravity in the human body is kind of in the middle of our pelvic area. And when everything's oriented around that, we're in the most efficient place. I always talk about efficiency. I'm just trying to help you when I'm working with an injured musician. I'm trying to help you be as efficient as possible. How little effort do you have to use to get the job done, right? And the more aligned we are around our center of gravity, the more efficient we are. So if we look at the head there, the average head weighs about 12 pounds. For every inch it moves off that, and typically we're looking at forwards with most musicians, but if it moves any which way off that center, for every inch it moves forwards, its effective weight doubles. So if you've got your head poked forward like that far right image there, you've probably got about 50 pounds of weight hanging off all those muscles at the back of the neck and shoulders. And how many people get problems in those muscles? So essentially, I always say, imagine if you had a tennis ball on your head. If you've got your head stuck forwards like that, typically that tennis ball would hit the deck, right? What stops you from your head from hitting the deck or head-butting your instrument in front of you? Well, it's muscle contraction, right? So the muscles at the back of the neck and shoulders are going to grip, go, whoa, we're falling forwards. We need to hang on and counterbalance this tendency to fall forwards. So we're now overusing the muscles at the back of the neck and shoulder. So the more we're over our center, the more efficient we are, because all that muscle effort doesn't have to begin, because that's muscle effort you're using before you've even picked up or started playing your instrument. Overload, right? So here's a few little examples of some choice body alignments around instruments. And I picked all of these because of that head position, right? In particular, heads in front of the body. All of those are highly inefficient. Now, I'm not here to say that there is this beautiful, sweet spot of posture that you have to be in all the time and you must never move. That's not real. You're musicians, you're artists, you're in performance. You should be in movement. I love to watch a dynamic performance. But what you don't want to do is get stuck there and hang out. And that's what a lot of musicians are. They're kind of just hanging out with their heads in this position all the time because they don't notice they're doing it. And it's only when I get them to video themselves and say, do you want to just take a look side view at what's going on here? And they're like, oh, I had no idea I'm doing that, right? So we need to find that awareness of where the head is. If you need to look down for one moment, great, but make sure you come back. Where is your default place to hang out? So the head being forwards is typically not an isolated thing. It's normally being driven forwards by what's going on with the alignment underneath. So typically the head forward posture goes together with a rounded shoulder posture, and the rounded shoulder posture typically goes with a pelvis that's kind of tucked under the body as well. So whether we're in a standing position to play and this kind of slumped position, this rounded shoulders, chin forward position, I call the disease of modern life as well, because everyone's on their phones, their laptops, right, in this position. So it's not just your instrument. And when I'm talking about addressing these issues, you should be looking at it in the context of your computer, your laptop, your phone, driving your car, all of it, right? You can't just change it on the instrument. It's about cumulative load, right? What is the exposure for all the things you're doing, not just playing your instrument. If you're someone who sits to play, then we kind of have, I call this the Goldilocks, right? Too much, too little, we want to be just right. Some people might find themselves in this tendency for overarching the spine. I find that less common. I don't see too many people doing that. What I typically see is that middle seated person there who's tucked under, tailbone between the legs, curved spine, curved shoulders, and then your head's automatically going to be shoved forwards by that. Versus that far right version there, where we've got the just right version, spine neutral, heads over the pelvis, most efficient position. A quick check you can do to check whether you are in the correct position when you sit. I always ask musicians when we're working on this kind of stuff, when you first sit down and when you're about to play, you should actually kind of tilt the pelvis a little bit and actually stick the tail out slightly so that you plant yourself down on your sitting bones. We've got these two bones at the base of the pelvis underneath your glute muscles. They're called the sitting bones for a reason, because we're supposed to sit on them, not behind them, right? So plant yourself on your sitting bones. And what you'll find is your pelvis is neutral, your spine has its natural curves. Remember, we do have natural curves. It shouldn't be dead straight, but the head's also oriented over the body. A quick check to know if you are in neutral is, as soon as you've sat yourself down, try and stand straight up again. Now, if you are sitting, and you can try this right now, I'm sure a few of you are sitting to watch this, and you might be already guilty of being in that slightly slumped position. If you try to stand up, if you're in that slump position, what you're going to find is you're going to have to throw your head forward and kind of heave yourself out of your chair. So if you go to stand up now and you find yourself having to kind of headbutt forwards, then you weren't in a neutral position. When you sit and plant yourself on your sitting bones, you can literally pop straight up, straight down, straight up, straight down. Bring your instrument in, ready to go, right? So that's the most efficient, and that's your little, excuse me, quick check to know if you're in neutral. All right, shoulders, right? So this rounded shoulder position, as we've seen already, top right there, we've got some very important nerves coming right through the front of that shoulder between bones and muscles. So now looking at some of these postures, seems I'm picking on the string players a bit here today, that we could get possible compromise of those nerves because of those shoulder positions. It may be that these musicians are starting to get tingling in the fingers, as we talked about, right? The signaling is going to start to get messed with if you're squishing your nerves up at your shoulder area. So keeping the shoulders open and wide is essential for getting good flow of information to your hands and fingers. Okay, so I thought I'd talk about a little bit here what I call the diagnoses of doom, right? I get so many musicians, who come in and they're obviously very concerned about what's going on, but they say, have I got carpal tunnel syndrome, or have I got tendonitis, like it's some sort of fatal condition? And so number one, I'm always saying, well, let's figure that out. You may do, you may not have, but also, what does that even mean? Do you know what tendonitis is? And if you don't know what it is, why are you worrying about how terrible it's going to be? Because it might not be, right? So when we start to pick apart these terms, we can start to get more objective about what is going on and clear about what we need to do to get out of that situation. And carpal tunnel syndrome is one that people don't like the thought of. Tendonitis, as we mentioned before, repetitive strain injury, or RSI. It's just a bucket term. It just means you're overusing something. It doesn't really give you any information. And then musicians' dystonia is one. That's actually quite a rare condition. So we're not going to dive into that too much today. But again, there are things that can be done for that. But these are sort of typically the ones that freak musicians out. So we're going to look at these, but we'll start just by looking at common shoulder muscle strain, because this is probably the most common thing. And one thing we have to note about muscles, particularly for us as musicians, is muscles in the body tend to fall into two categories. We have what are called dynamic muscles and postural muscles. So postural muscles are the ones whose job it is primarily to hold us up in space, and they tend to be the bigger muscles in the body. The dynamic ones are the smaller ones, a bit like the muscles of our forearms that operate the fingers. These are dynamic muscles. They're used for sort of fine movement, and they're not designed to be power lifters. What tends to happen with musicians, if we don't set the shoulders up correctly, if we've got a lot of tension in the shoulders and the shoulder position is not optimal, we end up making our arm muscles, which are by definition dynamic muscles, do a postural job. For a lot of instruments, we have to hold our arms in space, and for some, we're actually holding the instrument and our arms in space. And in doing so, we're asking them to do a postural job, right? Hold these up in the air and hold them still and don't move. Then on top of that, we're then saying, now we want our fingers to move like really fast. That's dynamic use. So you're asking your muscles to do two things at once, overload, right? That leads to injury. So what we want to do is make sure we get the big postural muscles doing their job, so that we take out some of the effort of the dynamic muscles and free them up for the dynamic jobs. And something you can try just sitting in your seat right now is if you stick your arms out in front of your body and let your head hang forwards and your shoulders round in those positions we've just been looking at. And after a while, you can feel the weight in your arms. It's a lot of work. The arm muscles are actually kind of holding the weight of your head up as well, because it's falling forwards. Then if you bring your shoulders down and back, open up the chest and hold your arms out in front of you, they feel much more weightless. Now they're free to do all the fine dexterous movement that you need to do on your instrument without being encumbered by all this extra load. Muscles, when you're off your center, have to grip, right? If you're holding muscles in space, they have to grip. When muscles are contracted, they have no blood supply, right? The fuel supply that runs through your muscle tissue in the form of blood, those little pipes that run through the muscle, if the muscle's contracted, it squeezes them out, which is why if you hold a heavy suitcase for a while or something, you start to get that burning pain in your arm. That's your muscle running out of blood and saying, can you let go? I need to reperfuse with blood. So typically what we'll do when we're carrying a heavy bag and we feel that, so we'll switch to the other hand. Then this muscle releases, blood rushes in, and it feels happy again. But if we're sitting at an instrument in that held position all the time, we're starving a lot of those muscles of their blood supply, which is oxygen, the fuel supply they need to operate, and we can start to get issues as a result of that. So we've talked about overload, overstretch, overuse, but typically that is coming from postural imbalances. If you load muscles in an imbalanced way for many, many years, which again is quite typical of musicians, what can actually happen, say if you're that chin poking person, these muscles at the back of the shoulder that grip all the time, what the brain will do is, if you're constantly gripping a muscle, it's quite inefficient from an energy supply issue. What it'll start to do is turn your nice elastic muscle fiber into a thicker, tougher substance that will hold your body in that position without having to actually contract the muscle to do it, which is why the muscles of your shoulder tend to feel a bit more like old boot leather versus, say, your thigh muscles, which feel much more kind of juicy and elastic, right? They're made of the same stuff. They should feel the same. But if you load a muscle, it's like we said before, rub your skin, you'll get a patch of hard skin. Load a muscle, you'll get a thickened muscle. And now the joints that muscle runs across are getting stiff, and you find you can't look over your shoulder when you're trying to reverse in your car or something, right? So we have to look at behaviors to unravel a lot of this stuff. So let's have a look at an example of tendonitis. So inflammation of the tendon, and we typically can see this around the elbow in musicians. And there are actually two sides of our elbow, the outside part of the elbow and the inside part of the elbow, where this problem can occur. The most common place is the outer side of the elbow, as in the bottom left picture there. That's known as lateral epicondylitis, throwing you all these terms here, but again, the epicondyle is the bit of bone this is the bone of your upper arm. It's a bit like a dog bone, and it flares out at the end in that sort of typical dog bone shape, and the outer flared portion is called your lateral epicondyle, and it's the point at which all the muscles of your forearm, because there's a whole bunch of muscles here that operate your fingers, they all blend together and become one tendon. So they share one tendon. Not every muscle gets its own tendon. This is a shared tendon that attaches on to that outer bone of your elbow. So there's a lot of force coming through there, particularly when you're a musician waggling your fingers around all day. So we can get inflammation of the attachment of that tendon into the bone, and it flares up the membrane around your bone on the epicondyle. Remember, itis just means inflammation. So you've got inflammation of the bone of your elbow where this common tendon is attaching. So the muscles on the back of your forearm here lift your wrist and fingers up towards the ceiling if you've got your palm facing down to the floor. And so all those attach to the outer edge of your elbow. On the inside edge of your elbow, on the opposite side, we have the muscles of the palm side. So if you've got your forearm facing up to the ceiling, the muscles on the palm side, they're the ones that bring your wrist towards you with the palm up, and your fingers as well. And they all attach onto the inner edge of the elbow. So we've kind of got these 2 points either side of the elbow. And if you're getting inflammation of that tendon, then it's known as medial epicondylitis. Medial is anything towards the middle of the body. Lateral is anything towards the sides of the body. They're also known as tennis elbow for lateral epicondylitis and golfer's elbow for medial epicondylitis. So you might hear those come from the sort of sports injury world. So often those terms are used by orthopedists and things. They'll say, oh, you've got tennis elbow. It's like, I don't play tennis, but it doesn't matter. It's just an overuse of that tendon. And again, if you are not using your big postural muscles of your back to hold you up, you send a lot more effort into these muscles to add to their load on top of waggling your fingers around on your instruments. Okay, carpal tunnel syndrome. So I remember I said tunnels are trouble, right? So this is a tunnel at your wrist. Your bones of your wrist are called your carpals. We've got 8 little bones in the wrist, and they're like little pebbles, little tiny pebbles that allow us to do lovely kind of circular movements with our wrists. And they they're kind of on the back of your wrist here, and then across the front of those bones there's a band, a sort of fiber-like ligament. Essentially, we looked at ligaments before, that covers that those bones at the front, and between those two, the bones at the back and that band at the front, there's a tunnel, right? Through that tunnel run 9 tendons. So tendons of your inside of your forearm that pull your fingers down in space, all run through. They're heading off to your fingers. There's 9 of them that run through that tunnel, plus one little nerve, the median nerve. And the median nerve, as you can see on the bottom left picture there, gives you sensation and to your thumb, your index finger, your middle finger, and half of your ring finger. So if you're getting tingling in any of those fingers, musicians often come to me and say, oh, I've got tingling or pins and needles in my fingers. My first question is always going to be, which fingers? Because it's going to tell me which nerve is going on. So if it's any of those 3.5, then we know it's the median nerve, and that's the one that runs through your carpal tunnel. If you're getting tingling in your pinky, that's not carpal tunnel syndrome. So anything that swells up in a tunnel, so say you're overusing your finger tendons that run through this tunnel, if they're getting angry, they're going to swell up and with inflammation. So therefore, the space in the tunnel is going to get a little tight, and that poor little nerve that also happens to run through there gets squished. So often it's an overuse issue of the forearm muscles that are causing the nerve to kick off. So sensory changes we've talked about, so tingling, numbness, even pain sometimes, but tends to be more just like a tingling and numbness. With carpal tunnel, it feels better when you shake it. And so often if I see somebody sitting outside my treatment room, if the next person is a musician and they're sitting there shaking their hand, I'll think, oh, they've got carpal tunnel syndrome. So when you shake the hand, you move the fluid out of the tunnel and it offloads the nerve and it feels a bit better. This one's horrible at night as well, because we tend to sleep with our arms kind of curled in when we sleep, and it squishes the tunnel. So people often wake up in the night and they have to like shake their hand to get rid of that kind of burning, tingling sensation. In extreme cases, you can get weakness, and it's actually the pad of muscle at the bottom of your thumb is the musculature that this median nerve serves. So it can start to, you can start to get weakness in grip, like trying to pick up a coffee cup or a heavy kettle or something. You find it's weak, or you might find it weak on your instrument, whatever it is you play. That tends to happen further down the line. So the tingling often will have been around a lot earlier than the weakness. So that's what carpal tunnel syndrome is. It's a squishing of the nerves. So we have to figure out what's getting inflamed, what's causing things to swell up in that tunnel, sort that out, the problem should go away. So here's some risky wrists for you. That guitarist on the top right there, that dropped wrist position, you see how he's almost got like a 90-degree angle at that wrist. He's completely squishing his carpal tunnel there. So that's a risky position. And what's he doing with his fingers? He's using his wrist flexor muscles, which are those 9 tendons that run through, or it's 8 of the 9 tendons that run through that tunnel. So we've got, you know, a lovely kind of recipe there for an unhappy median nerve. And then the on the piano there, on the left of the screen, you see this, what we call the deviation of the wrist. This is a neutral position for the wrist, right? Straight up, straight down from your forearm. When you kink your wrist one way or the other, things have to go around corners, right? Tendons have to go around corners, nerves have to go around corners. And that's where, you know, I always talk about tendons and nerves being a bit like a rope on a cliff edge. You know, if you're rubbing your tendons and nerves on the bones because you're making them go around the edge of a cliff, you're going to get fraying and irritation, right? So we need to minimize the journey around corners that wrists and that tendons and nerves have to take. Playing flute, again, we tend to have this kind of kink in the wrist there. And obviously there are limitations with these instruments. We're not going to be able to completely eliminate this. We can't play all our instruments in a completely neutral position, but we can minimize it. If that flute player there would actually engage the muscles at the back of her shoulder and open up, it would actually reduce the angle at the wrist. So normally it's not something I'm going to change locally. I change it centrally. I get the musician to change something centrally that lessens the angles further down the chain, right? So start at the center and work your way out so that you don't have to do anything, because as soon as we start to change anything at the wrist or the fingers, we introduce tension typically, and we're trying to get to a place of minimal tension. We want freedom in these hands and wrists, right? We don't want to be loading them with too much else to do. So change the central structures. Remember, they're the big postural muscles that are designed to do this stuff, and free these guys up. Okay, now another tunnel this is something that it's probably the most common nerve compression that I see personally with musicians, is something called cubital tunnel syndrome. So not carpal tunnel, the cubital tunnel. You don't have to remember all these names, but just to give you an idea, this is now the ulnar nerve. So we talked about the median nerve being the thumb, index, middle, and half your ring finger. Well, the other fingers, so the other half of your ring finger plus your pinky, are served by the ulnar nerve. And this one, you know, if you bang your elbow and you get your funny bone, right? You get that kind of like electrical jolt. That's your ulnar nerve. It's actually quite superficial right at your elbow. Most nerves are buried in the body because they're delicate and we don't want to damage them. But the ulnar nerve is one that's really quite superficial, which is why you can catch it if you kind of bang your elbow or you lean on it awkwardly. So it's going around a bend here, obviously, and particularly if you're playing an instrument, a bowing instrument, acoustic guitar, where that elbow is often leaning on a thickened instrument, obviously electric as well, but with the depth of the box of an acoustic guitar, often that can be a problem right on that ulnar nerve around the elbow. So typically, if you're getting some sort of squishing and compression at the elbow, you're going to feel it in the fourth and fifth fingers. And again, same thing, numbness, tingling, and it could be weakness as well of those fingers, or loss of power, loss of speed on the instrument. So I've seen this quite a lot in bass players on the left hand because of their elbow position and extreme kind of accommodations, trying to reach different positions on the fret. And it's like, oh, it's like my fourth and fifth finger, I've got no power in my little finger. I can't, create the pressure on the string. I even had a bass player years ago he was playing in a concert, and his fourth and fifth finger locked on the instrument. Fortunately, it was the last song of the gig, and he managed to kind of work his way around with the other fingers. But it was basically an ulnar nerve that just had kind of, kicked its boots up and said, "I'm done." So, but it was perfectly manageable. We figured it out. But these are the sort of things that you might experience. But that's cubital tunnel. So that's squishing of the ulnar nerve around the elbow. It does have a little tunnel it goes through at the wrist as well. It doesn't go through the carpal tunnel. It goes under another bone. That's not something that typically gets injured in musicians, but some people who ride bikes, who cycle. I've got a few musicians who actually do mountain biking again, and sometimes on the handlebars you can get sort of impact into the wrist there, and the ulnar nerve's right on that sort of exposed edge there. So I have seen people getting tingling, again, not from playing their instrument, but from doing their mountain biking. So lots of things lots of jigsaw pieces you have to look at. And so the musician's dystonia, just to give you a little overview of that, as I say, it's a rare neurological condition, but it is, quite serious when you do get it, which is why a lot of musicians have heard of it, because it's kind of like that horror story, but it's pretty rare to get it. But what happens with that, this is not a painful condition, so it doesn't feel like an injury in that sense. But what happens is you get involuntary movements happening. So it happens in the hands for pianists and some string players, guitar players. And it's like, it'll express differently in different people. But essentially things will happen like, when you depress your index finger, your pinky goes up in the air, or you get curling, involuntary curling of the fourth and fifth finger in certain positions on the piano or on the strings. And so it's literally like your fingers are doing things you're not telling them to, and then they're not available. They just disappear. They collapse underneath you. Some people get a tremor with it, but it's actually a neurological condition. It's not a local problem in the hand like a nerve compression issue. It's actually a wiring issue to do with that motor cortex, the bit of the brain that's sending the signal to the muscle. So we see it in hands, but we can also see it in the embouchure muscles around the mouth here in woodwind and brass players, where you start to get tremors, and it'll often only happen in specific pitch ranges. That's why it's such an interesting condition, because it's happening in the brain. It doesn't sort of seem logical sometimes with pianists. Often if you it'll happen when they're playing on the keys, there's all these weird things going on. If you put the lid down of the piano and have the mime playing on the lid, it doesn't happen. So it's very what we call task specific, because it's the brain, it's about the nervous system, and the nervous system is highly contextualized. It'll see your instrument and it'll go, oh, at that instrument I run this software program and this crazy thing kicks in with that software program. If you have a pianist playing on a desk, for instance, miming playing, it doesn't happen, because the brain goes, that's not a piano. I'm not running that software program. I'm running a different one. But it's those sorts of things we can exploit to help get rid of this. So there's no known cause. It's one of those ones that they don't really know what causes it, but there are risk factors. Obsessive over practicing is one, believe it or not. So it tends to happen in the sort of highly driven sort of type A perfectionist personalities. And there's quite a few of those in the industry, right? Anxiety can be in there, fatigue. So people who have obsessively practiced and they've just basically worn that motor system out. It's just freaking out. It's going, I'm done. I need to kick my feet up and take a nap, right? There are often technique and postural issues that are part of the mix. So it's something we need to look at from a sort of multifactorial perspective. And there are lots of different methods around now of sort of retraining that nervous system, recreating new software programs to get around the one that's kind of misfiring. Okay, so we're just going to finish off with some things that you can do. And these are going to be very generic because we've been looking quite generically today. But really, we're talking about, you know, what I call the posture of least resistance, right? How efficient can you be? How little do you have to do or make your muscles do to actually get to your instrument and then play it? And a lot of that is just about being oriented around your center of gravity. The neutral position for the body is that kind of head over the pelvis, and with the arms, if your arms were by your sides, your palms facing forwards. So if you put your arms by your sides with your palms placed forwards or facing forwards, your body's in the most neutral position. So we're looking at like the arm muscles, for instance. As soon as you turn your palms down the other way, which you have to do for a lot of instruments, if you think of the muscles and tendons running up and down those arms, they've gone into a more twisted position. If you think of having a towel that's in its normal alignment and you can kind of bend it and pull it out with quite a lot of movement. If you twist that towel, you're going to find not so much movement and glide, right? So as soon as you start to twist anything, now we've got tension in the system, inefficiency, blood supplies being compromised, nerves might be getting squished, things are having to go around corners, right? So we start to go down that slope. So knowing where neutral is, there's no instrument you can play from a purely neutral position, but if you can minimize the twists and turns you have to make to get to the instrument, we're minimizing the risk, right? My generic term for sorting shoulders out is put your shoulder blades in your back pockets. So if you look at that back view picture there, we've got our little shoulder blades that are like triangles that sit on the back of the rib cage, and over the top of them you can see that big lovely trapezius muscle that has that sort of V shape. So you want to think of the little points of the triangles of your shoulder blades following the line of that V down to you, right down to your lower back. So you pull those shoulder blades down and slide them into your back pockets, right? What we don't want to do, a lot of people think they have to do, is pinch the shoulders behind them. That's tension as well. That's not helping anything. So we don't want to pinch the shoulders back. We want to anchor them right down into the lower back. So we're using all the big back muscles to hold our shoulder blades and anchor them in place. That provides the postural load we want and frees up our lovely shoulder and arm muscles to do the dynamic stuff. In doing that, we're going to keep the chest open as well. I always say if you take a tape measure and measure your shoulders from one to the other across the back and one to the other across the front, they should measure the same. And a lot of people have a very short journey at the front and a very long one going around the back, right? Keep the chest open, and that will happen naturally if you put your shoulder blades in your back pockets. Then we're taking that pinch out. Remember where those nerves run, right in the front of the chest there. We're opening up the space so we're not squishing the nerves. Keep that head over the pelvis so the head weighs 12 pounds, not 50. And we're getting into the right territory. Self-care, right? A lot of this is what you do for yourself. Warming up before practice, and I'll get into that in more detail in some of the ones where you look at specific injuries or specific body areas. But warm up is about blood flow. You want to get your circulation going. You want to be jogging on the spot, getting your blood flowing. It is not about doing scales. You need to be warm to do your scales, right? You need blood flow to your muscles. So you want to just be swinging your arms around, jogging up and down, even just rubbing the muscles, bringing the blood to them so they're ready to start working. And we should also cool down after practice, not just drop the instrument and then go and sit at your desk and computer. Think about your exposure. If you sit at a piano doing this all day, in your breaks, you shouldn't be sitting at your computer doing that. You're still doing the same thing. You're not taking a break, right? So cooling down after practice. So typically just slowing things down. If you've been doing some dynamic work, some fast pieces, just start some stuff that slows you down, and then you're going to get into some stretches and things. And again, I haven't got time in this talk to talk about specific stretches, but stretching is to be kept for after practice. We don't stretch before. When you stretch a muscle, you actually kind of chill it out, which is what we want at the end of practice, but you don't want to start playing with a muscle that's kind of out to lunch, right? So you save your stretches for after playing or the end of the day. Take breaks. Don't practice for 4 hours without stopping, right? It's just not going to work. It's overload, it's overuse. What we typically say is 20 minutes on, 10 minutes off. And that doesn't mean 10 minutes on your laptop or your computer or your phone if you're using your fingers when you're playing. Get off all of it. Obviously, that's not practical for all times. If we want to practice long pieces that are longer than 20 minutes, we have to go through them. But just generally break things up, or take 10 minutes out of every hour. But make sure you've got some downtime. Pay attention to nutrition and hydration. Okay, your muscles, tendons, all these structures are a product of what you eat, and we don't want inflammation in the body, because that's going to increase our injury risk to muscles. So paying attention to what you eat, making sure you've got fuel in the tank for performance. And hydration. Okay, muscles, all our soft tissues require a lot of fluids, and you're working them a lot. They dehydrate as you practice. You need to rehydrate. A dehydrated muscle is going to be less elastic and more prone to damage, right? Get physical exercise. You need blood flow to your muscles. You are an athlete. We call our musicians the athletes of the small muscles. What you are doing, the load you're putting through them, is every bit as athletic as somebody who's running track, but they're just running it through the larger muscles of the body, which are actually more designed to do that. So we're really not using our bodies in the way they're designed for when we're playing instruments. So we need to be approaching this in a very athletic way. If your cardiovascular, your heart health is not good, you're not getting good oxygen delivery to your muscles, they're going to fatigue more quickly, and they're more prone to injury, right? So having a good oxygen pump, which is your heart in the body, is key. Get out, get some exercise, do some cardio work, so that you've got good blood flow to your muscles. And of course, stress management. Stress, as I say, I've got a video on how your emotions affect practice. It's going to increase your injury risk, and it has all sorts of other health implications, of course, as well. So finding balance between practice and play, and I don't mean playing your instrument, go and play somewhere else, go and have some fun, get some exercise, and get some balance. And then seek help. You know, don't be that musician with the head buried in the sand, right? If your symptoms are going on for more than a few days, don't ignore them. Go and check it out. A doctor, a physical therapist, massage therapist, osteopaths, chiropractors, all these guys will be able to help you to start to unpick what might be going on. Getting just regular treatment preventatively. You know, I always say take your car to be serviced and get the oil checked at least every year. Why don't you do the same for your body? We can pick up things in the muscles, say, for instance, giving you a good massage. I can pick up on things that you might not have any symptoms from right now, but they're on their way to getting there. So let's jump on that before they become symptomatic and stop the problem happening in the first place, right? So we can preempt things with a bit of prophylactic treatment. Psychology and nutritional counseling. If you don't know how to fuel yourself for performance and eat the right things to heal from injury and stuff, get some help with that. And I've put some resources there if you want to take a shot of this screen. So you've got those websites. PAMA is the Performing Arts Medicine Association. They have a worldwide register of practitioners. So you can say, I'm a violinist in Sydney, Australia, and I need to see someone, a physical therapist for a shoulder problem. Everybody on the practitioner registry there has a documented experience of working with musicians. I always say you've got to find help from the people who know what you do for a living, because most of the reasons you got the injury are in the technique, the alignment. And if somebody doesn't understand that, they're not going to be able to help you get to cause. They're only going to be dealing with switching off symptoms, and that's short-sighted, right? Musicares, if you're in the US, they have a great resource for health, for musicians seeking healthcare, and also funding for healthcare as well. If you're in the UK, we have BAPAM, the British Association for Performing Arts Medicine, who again have clinicians in London and around the country, and a register of practitioners around the country who are all again experienced with working with musicians. You can always reach out to me. There's my details. I know most of the practitioners around the world who do this, or I know someone who knows someone. So I'm often just fielding emails and saying, you know, I'm a musician, I'm heading off on tour to, you know, the Netherlands or something. Who do I have to take care of me there? And I can find amongst my network the go-to person. So I hope that's been a helpful little introduction for you. It was very kind of general, but at least you start to inform yourself about what are the sort of things that can go wrong. What are the general things that are very easy for you to do to offset and preempt any injuries happening. And if you want to get into more detail, you can dive into more of the resources that I have that will look specifically at the shoulder or look specifically at guitarists, so that you can start to refine your journey and make it tailor-made to help answer your questions. And in the meantime, I'm always here too. If you want to have a session with me, just reach out and we'll take a good look. Okay, so go take care of yourselves, take a rest, go and have some fun, and I hope to see you in another video soon.